Welcome to my channel Psych-o-jelly. It's such a pleasure to have you here with me today.
Hello, Priyal. Thank you so much. Same here. Pleasure is all mine.
Thank you so much, ma'am. Today, I hope we can discuss some common myths and misconceptions about dental health problems and dentistry in overall that most people have. But before I begin, it would be great if you could introduce yourself to our viewers. A small introduction would be lovely.
Yes, sure. So, Priyal, I'm Dr. Ritu Kathpal. I'm consultant at Kathpal and Care Clinic, Ludhiana. It is situated in Aganagar. And I have graduated in year 2000 from PGIMS Rohtak. And I have been into dentistry since last 20 years.
Thank you so much, ma'am. It was lovely getting to know you. My first myth, like before I begin with some official myths, could we just know some general myths about dental health problems that everyone supposedly have?
Yeah, Priyal, that is actually a very, very important question to be dealt with because there are a lot of myths which really need to be busted. First and foremost, the patients visit the dental clinic only when they have pain. I mean, if the patient is asymptomatic, like the dental problem is advancing, but the patient is not visiting the clinic because he is asymptomatic. Accordingly, the patient has to visit the dental clinics every 6 months so that if any small problem arises, like if there is any discoloration, any decay in the tooth, or is there any gum disease, bleeding from the gums, which normally the patients ignore, it can be addressed, well in time. But the patients usually ignore because they do not have any symptoms. So that is the main problem which needs to be addressed. One. Second, regarding the milk teeth, the parents do not give any importance to the milk teeth, thinking that they're just going to go off. They're just going to fall away. So parents are thinking that the milk teeth, even if they have cavities, doesn't matter. So they do not visit, they do not make their child visit the clinic unless and until the permanent teeth erupt, right? And or the child has pain. They do not visit the clinic. Sometimes, pus formation is there. A lot of pus oozes coming out. Big abscesses are there. Abscesses are, there in the child's mouth. Only then the parents will make the child visit the clinic. Before that, they just keep on ignoring, just thinking that these are the milk teeth, these are the deciduous teeth, and they will just shed. So that is the myth which has to be busted because the deciduous teeth play a vital role for the child's development. One. Second, they help a lot in chewing. Third, they act as, the placeholders for the permanent teeth. For the permanent teeth to erupt, they play a very vital role. So they really need to be maintained.
Thank you so much, ma'am. I think the milk tooth myth you just discussed is very important since I think parents should be aware of it. So thank you so much for sharing that with us. Is it true that sugar is the main cause of tooth decay?
See, Priyal, sugar is no doubt a very, very crucial aspect of tooth decay because it leads to tooth decay, but it is not the sole cause of tooth decay because there are a lot of other factors which play a vital role in tooth decay. First and foremost is the poor oral hygiene. Like people are not brushing their teeth properly, and the blame game is on the sugar. That we are consuming a lot of sugar, we are having a lot of cravings of chocolates, and we are having a lot of cravings of sweets. That is why our teeth are getting decayed. No, but if you're brushing twice a day, you're flossing your teeth regularly, even if you consume small amount of sugar, it is okay. I mean, you can enjoy those cravings also sometimes, but you have to keep your mouth clean. One. Two, if you are eating a lot of starchy food apart from sugary food, like the chocolates or the sweets or the colas are not just the culprits, but the starchy food, like the food made of refined flour, right? Food made of maida, pizzas, burgers, pastas, Maggi, noodles. They are also lethal for the teeth. So it's not just the sugary food, which is playing the sole cause for tooth decay.
That was very surprising to know because till now, even me included, I've also always thought that yes, sugary things or even cokes and colas, they are main causes of tooth decays, but I had never thought that pizzas or burgers or some like junk food, basically the savory junk food, could also cause tooth decay. So thank you for sharing that with us. Also, like you mentioned in the starting, Some people have discoloration on their teeth, and I've heard that many people use whitening pastes to like scrub that off and like recolor, basically re-whiten their teeth. So is that safe to use? Are those safe to use?
See, Priya, actually speaking, the whitening toothpaste should not be used without the dentist monitoring the patient. Because the whitening paste, which nowadays has become a trend, because the teeth are getting pale because of a lot of soda drinks, because of a lot of alcohol intake, all those Red Bulls and energy drinks and vaping and all that stuff coming in. So the teeth are getting yellow in the process. So the patient gets lured for whitening the teeth. But if the patient is like the patient is using whitening toothpaste on his or her own over the counter, he's taking those paste and using those whitening gels or paste, that is hazardous for the teeth, because that wears off enamel in the long run, which is the first and the foremost layer of the tooth, which is very, very important. That is the most mineralized structure of the tooth, which protects the tooth against destruction. And once it wears off, a lot of problems come in regarding sensitivity to hot or cold or sweet, a lot of other problems, a lot of cervical abrasions, a lot of gum diseases come in. So I really do not recommend those whitening toothpaste without any professional guidance or without any professional monitoring.
Thank you so much, ma'am. Also, many people nowadays, like you said, whitening gels and toothpastes are a trend. Mouthwashes are also have become a trend. I mean, not recently, but since like a past few years, I'd say many people use mouthwash as well frequently. Can mouthwashes replace brushing, and are they safe again to use?
Yes, Priyal, that is again very sad because a lot of patients are pouring in our dental clinics and it's really difficult to counsel them. They are like really, really convinced, pre-convinced, and they have a wrong notion that we are not brushing in the night, we are just using mouthwash, we are just using Listerine or, all those fancy kind of mouthwashes. But real mouthwash is never a substitute for brushing, never ever a substitute for brushing. You can use mouthwash off and on apart from brushing and flossing, but 2 times brushing and flossing are mandatory on a routine basis. Apart from that, you do whatever you want to do, but please do not skip your brushing for a mouthwash.
That was great to know, ma'am. Also, finally, does oral health affect mental health in some way? Like maybe if like you've mentioned again and again, pale teeth due to all the like smoking and vaping and consumption of sodas, and then other like bad breath or something. Can these dental health problems, or maybe even missing a tooth, can these overall affect our mental health?
A lot, because so many habits are coming in because of that. The mal alignment of the teeth is very, very common. Malalignment of teeth, the discoloration of the teeth, as I mentioned earlier, because of the faulty food and the fault. And again, because of these habits like drinking and smoking and taking so much of alcohol, which is really trending nowadays, and it's very, very sad for the young generation to falling prey of all this. So I really think that this really needs to be addressed.
Yes, ma'am, absolutely. Thank you. And to end on a happy note, could you please provide our viewers with some useful everyday advice and preventive measures to keep good, like keep good oral health overall?
Exactly. First thing, most of the people are thinking that the dental problems are based on the genetics, that the genes play an important role for our oral health. So they will blame their parents that my mother used to have this problem, so I have this problem. Or my mother or father did not ever have the dental decay, so I will never have a dental decay. So they have this assumed notions in their mind that we are not going to visit a dentist because our parents never used to have any problem. So we are also not going to have any kind of problem. So this is a very wrong notion, which needs to be cleared. And the people have to visit their dentist every 6 months, which is very, very important. One. Second thing, maintaining a good oral hygiene means brushing twice in a day. That is there, but the technique of brushing is very, very important. Like the way you're brushing, that really matters. Even if you're brushing just for 2 minutes or 3 minutes, that's okay. But if your technique is okay, I mean, you're giving the correct strokes to the teeth, that is very, very beneficial for the teeth. But if you're using wrong technique, you're taking a lot of time brushing, you're just brushing once a day, and you're using your brush very forcefully, thinking that you will clean your teeth and you will polish the surfaces of the teeth. No, you are actually, spoiling the health of your teeth in that process. So the correct technique of brushing is very, very important. And brushing is not the only aspect of cleaning. Flossing and interdental cleansing of the mouth plays a key role for the dental hygiene. There's so many times the dental decay is in between the teeth. It is hidden, absolutely hidden, which you cannot see. The surfaces that you cannot see, the brush cannot clean, So those surfaces have to be cleaned with the help of a floss or with the help of an interdental brush. So apart from brushing, flossing and interdental cleansing is very, very important. And third, visit your dentist regularly for a good oral hygiene.
Thank you so much, ma'am. Just a small follow-up question. Like you mentioned, brushing hard on your teeth, does it actually spoil the enamel of your tooth? And
Exactly.
can we use electric toothbrushes instead as well?
See, Priyal, electric toothbrush again is very, very technique specific. Unless and until you are a pro or you come to the dentist, learn the strokes, how to use that electric brush. Do not attempt using electric toothbrush on your own because it is very, very technique and stroke specific. And if you are using electric toothbrush just by hit and trial method, you end up abrading the surfaces of the teeth. You end up wearing off the enamel, which is again, as I mentioned earlier, the hardest and the protective layer of our teeth, which really needs to be maintained. And the electric toothbrush, using electric toothbrush on your own, I will never recommend. Use a simple, super soft toothbrush, like a Colgate sensitive toothbrush is good enough. Oral-B Ultra Soft is good enough. Any super soft toothbrush will do. If you want to use electric toothbrush, use under the guidance of the dentist, not otherwise.
Thank you so much, ma'am. It was absolutely lovely talking to you, and I hope everyone will gain such valuable insight and will be able to overcome the myths that they have in their minds and start following good practices to um, practice good dental hygiene in their everyday lives. Thank you so much for providing us with such guidance.
Thank you so much, Priyal, and the pleasure was all mine that I could make the people aware about their oral hygiene, and especially I could make the kids aware about their oral hygiene, which is a very, very important and pivotal in an era which involves a lot of junk food industry and a lot of drinking and a lot of vaping and everything. So it's very, very important to maintain the oral hygiene and eat local, think global.